Off of a clinical trial, I would say that patients who are have received chemotherapy and their tumors are growing, I consider all of these patients, I consider immunotherapy for all these patients. Not all patients will be candidates for immunotherapy, but we do now have 3 drugs that we can use, nivolumab, Opdivo, pembrolizumab, Keytruda, and atezolizumab, Tecentriq, that have all shown survival advantages. 2 of these drugs can be used independent of PD-L1 testing in the chemorefractory setting, and that's Opdivo and Tecentriq, or nivolumab and atezolizumab. And 1, pembrolizumab, can be used for tumor proportion scores greater than 1%. So I think it's routine now for patients that are chemorefractory and which are no longer deriving a benefit from chemo, or not either in terms of they can't tolerate it or their tumor's not responding. These are patients that we should consider off of a clinical trial with immunotherapy. And then I've yet to use pembrolizumab up front. I have not yet identified a tumor proportion score greater than 50%. I'm not sure why that is. They're out there. In the literature, it's 25% of patients. Keep in mind, this data just came out 3 or 4 months ago, and I've switched institutions, so I'm a little lag behind in terms of the clinical practice, in terms of the patients that I'm seeing, but I know soon I will find somebody with a tumor proportion score greater than 50%. I just haven't had it yet.